this is Vocal. I'm the director of Vocal. I've just put here a screenshot of our website, which was actually co-designed with patients and members of the public. So it's really aimed at that audience. So who are we? We're a group, a team of around 12 that are based within Manchester University NHS Foundation Trust, but working across the whole kind of research landscape within Greater Manchester. What do we do? Our vision, our role is to connect people, patients, communities, and health research, really for everyone's benefit. And I suppose you would call us specialists in patient and public involvement and engagement with research. And do please visit our website, links at the end of this presentation, to find out more about all the kinds of work that we do. But as Andy said, public involvement is a really integral component of applications to NIHR, to Wellcome, and to many other funders. And we're certainly able to support, as the RDS is, applications to all of these funders. We're an integral part of lots of NIHR infrastructure within Greater Manchester. So we've got, kind of very much an integral part of the NIHR Manchester Biomedical Research Centre and clinical research facilities. Also, obviously, work with the RDS and other NIHR and research projects and infrastructure within Greater Manchester. And on this slide, I've got a link to our strategy, and we have developed a strategy so that we can apply the principles of all of our work across all of the partners that we work with. So, for example, if you go and visit the strategy, you'll see that there's a really strong focus on inclusive research. So working with those people and communities who stand to benefit the most from research and whose research stands to benefit the most from listening to different voices and raising awareness of research within different communities. So go and have a look at that strategy if you'll find it useful, and you might see how it could be applied to some of your work. So much like science, much like research, public involvement and engagement comes with its own jargon and with its own abbreviations. You'll see here a few different definitions from funders and from partners. So NIHR Involve, which was really the main focus of NIHR's efforts around public involvement until recently, draws very much a distinction between involvement, participation, and engagement. So involvement is where members of the public are actively involved. So they're acting as research advisors, if you like, for research and research organizations. Participation is when people take part in research, and engagement is the more kind of shared learning, shared awareness, making sense of research and science. Wellcome has moved forwards its kind of strategy on public involvement, and its two main kind of aims for public involvement are to empower people, so helping people to respond and appreciate, I suppose, health and research and innovation. And then bringing that lived experience, bringing that living expertise into research to create people-centered health research. And, much like we talk very much about patient-centered care, this is about people-centered health research. And together, the ultimate aim is to, help us all kind of value each other's work and develop relationships of trust between science and research and society. And clearly, living through COVID is an example of how science, society, research and health is really kind of mutually dependent. So our approach at Vocal is to actually bring the kind of, I suppose, the very closely aligned fields of engagement and involvement together. And so, yes, it's bringing health research and people together for everyone's benefit. And again, if you want to find out more about our approach, how we evaluate our work, what our strategy is, how, and some case studies of what we've done in the past, you can go to the link on this peer-reviewed paper that's been published a couple of years ago. As well as having our strategy and, a very defined approach, we work very much within the context of the national standards for patient and public involvement. So we work within this context, and actually we were also instrumental in developing the standards. And if you've not come across these standards before, do go and have a look and just think about how they might apply to your research context and to the people you work with. They're not strictly speaking standards, they're more a set of kind of guiding principles for how patient and public involvement should work, especially in the context of NIHR-based research. And more practically, what can public involvement and engagement help with? So these are some of the questions that researchers will come to us with and want to be talking through with patient and public contributors. So things like, am I measuring the most relevant outcomes for patients? Will people understand my patient information sheet? All those kinds of things. These are the kinds of questions that we deal with on a daily basis, working with our public contributors and our patient partners. And it's through kind of working together in research that we can really feel the benefits of public involvement. So as well as informing research, public involvement has been demonstrated to increase people's agency, the sense of themselves and the difference that they make in the world, their knowledge and confidence about research. Research clearly benefits from having diverse perspectives and from bringing in that living experience and expertise of people who are, kind of often going through very challenging situations. There has been a link established between effective engagement and involvement and wider participation. There's still emerging data on that, but it is definitely linked. And some of the projects that we've worked with have really worked with communities, especially communities who might be less well listened to in research, to really think about how to design effective recruitment strategies and how to co-design effective recruitment strategies with the people that, that stand to benefit the most from research. As I mentioned before, increased relationships of trust through public involvement, and ultimately real and effective changes to service delivery by taking a very inclusive approach to health research. So one of the questions that Becky suggested the answer is what kinds of researchers who can work with us? And really the answer to that is anyone. We work across the whole research, translational research spectrum. So from basic laboratory based scientists through to applied health researchers, and everything in between across all research areas. So we work in genetics, we work in maternal and fetal health research, we'll work in respiratory research, we'll work, in a very wide variety of research settings. So we've yet to have encountered a research setting that has really stumped us. So, but I'm always open to that challenge and seeing what we can do. But yeah, and we're always really interested to find out more about research and what's going on and how we can support the public involvement to your research. I've just put here, the kind of research cycle diagram that we work to, and this will hopefully apply across many different areas of research. And this is how, just some really short examples, they're not exhaustive at all, about how public involvement can feed in to those different layers of the research cycle. So, you know, you might want to work with communities to clarify the research question or even to hone it down more. Lots of work around dissemination of research and how to work, especially with different communities, to disseminate some of the research findings, help with writing protocols, and, you know, really importantly, thinking about how to translate research findings into design and implementation of services. And again, just coming back to the day-to-day, to the tangible, you know, these are some of the questions that researchers come to us with in terms of wanting to think about public involvement in research. And we will always work with researchers right from the outset to really hone down the purpose of public involvement. And then that can make designing it and implementing it much easier once we're all clear about the purpose. I just wanted to give you a couple of examples of some of our case studies. So you can access these through the links at the bottom of each slide. But this is an example of a project that we did called Breathtaking Lungs, which was really kind of combining both public engagement and patient involvement. This study, well, this project was based in Wythenshawe, so which is an area that has a pretty high incidence of lung conditions. It's quite close to the airport. It's an area that has quite high indices of social deprivation. And right on the doorstep is Wythenshawe Hospital, with a fantastic, amazing respiratory research centre and lots of researchers working in this area. So we really brought together the two. So we did lots of community-based activities, raising awareness of lung health and lung research. We did this in community centres. We did this with younger children. We did it with patients. And as a result of that engagement, many more of the local community with specific respiratory conditions are now working hand in hand with those researchers in Wythenshawe to design and deliver research, to bring in those lived experience and to the research that is going on. So and so we've fostered a community of, if you like, patients and community members and researchers who are working together to improve lung health. Another example is in a really sensitive and emotional kind of research area. So discussing stillbirth and neonatal death, which is part of the Maternal and Fetal Health Research Centre within the University of Manchester and MFT. And here we worked really specifically with Jewish communities, partly to raise awareness of some of the research going on, but partly also because the researchers in the research centre had identified that they weren't engaging or involving those communities in the research that they were doing. So through a kind of joint creative approach of workshops and kind of discussing some of these taboos, there is a much greater level of awareness of some of the research going on within these communities, and the researchers in the maternal and fetal health research centres are now including those communities on their research advisory groups in the design and delivery of research. And I've mentioned our research advisory groups. We have very many research advisory groups that are there to support all different kinds of research. If you go to that link at the bottom of the page, you'll be able to see all of the research advisory groups that we support in one way or another. And these are just a couple of examples of some of those research advisory groups. But we also do have very specific, condition-specific research advisory groups too. Not quite sure how much time I've got left, but I just wanted to, you know, kind of again get into the nitty-gritty. If you're submitting a grant application, what do you need to think of in terms of public involvement? So these are some typical NIHR application questions. So, you know, kind of as Andy mentioned, there's sometimes a bit of a catch-22. Funders are asking for public involvement before a grant is submitted, but then, you know, how do you do that? How do you resource it? All those kinds of things. So I think this is where we can help. So these are some of the questions, you know, that are asked in an NIHR application form. We would typically sit down with a researcher, potentially also with a public contributor, and work through some of these in advance of a grant application. Or you might want to be doing something that is outside of an application form. And certainly we work with very many researchers in that way. And these are just, you know, these are just some of the ideas. I do need to say that we are I suppose we're a unit that operates on a cost recovery model. So everything that we do does need to be resourced in some way, shape or form, but we're very open to, you know, kind of providing initial advice and starting initial conversations with a view to then thinking about a grant application and being costed into that, for example. Funders are always keen to see how effective PPIE has been planned, public involvement has been planned, and these are some of the things that we would talk through with you as researchers, in particular thinking about the communities that we work with and how to be culturally appropriate and how to reach those who are perhaps less well listened to in research. And this is just really a slide to emphasize the last point. We have a really, really strong focus in Vocal on health inequalities and how we might address some of those health inequalities through translational research. So when we sit down with researchers and start thinking about public involvement, some of what we will also do is thinking about really defining who the people are that need to be engaged and involved with the translational research that is happening. And so again, these are just some of the questions and the steps that we would go through in thinking about public involvement as part of research. And I'll stop there. I'd love to hear your questions or reactions to what I've just been talking about. And yes, I'm assuming the slides will be circulated afterwards. So you should have all the links to further reading there. Thank you.